Hi, I'm Dr. Nick from Smile Clinique, and I'm just going to be going through a case I've done recently for this young man to improve his smile with some composite bonding and a bridge. So his main concern was obviously the gap. He was born without these teeth, so he didn't have these teeth. So it was either trying to close the gaps, which are very big gaps, or filling the gaps with something. So that was the main concern when he came to me. That's what he wanted to fix. So this man presented to me after having some orthodontic work done with braces. He was missing these two teeth naturally, and he wanted to fill the gaps. So the orthodontist has left the space open for us to fill up with something like a bridge or implant, but the patient preferred a bridge, so we went down the bridge route instead. So this is how he came to me, with the gaps in between. He's got quite narrow front central incisors as well, so we plan to do some composite bonding to widen them slightly and then fill the gaps with a bridge. So if you look at the next one, this is the planning that I've done, just to look at the proportions of where we're going to add composite bonding and the spaces in between. So after doing the composite bonding, we took some shade tabs to check the shade of the teeth to send to the laboratory where we were making the bridge, so when the bridge comes back it will match nicely with the smile, and then this is it when the bridge is fitted. So we've got the before and after of his face, so this is before we had the bridge fitted, and then straight after with the teeth forward. So you can see the difference in the smile. He's very happy because now he can go about his business smiling and showing off his new teeth. I think immensely, because if you saw, like you see the picture of his face there, you can see that's the first thing the eye is drawn to, those gaps in his mouth, and then just doing a little bit of dental work just to fill in the gaps makes a huge difference. So when he's sort of even at work or like he's dating socially, it makes a big difference to his confidence as well, so he can talk to people without feeling sort of embarrassed that he's got gaps. The treatment was pretty quick, to be honest. We spent 2 appointments in total, 2 weeks apart. The first appointment was doing the composite bonding. That appointment took about an hour, hour and a half, just to get the aesthetics right. And then we took a scan straight after with photos that I've shown you, which we sent to the lab. And then 2 weeks later, we got him in to fit the bridge to complete the smile. So very quick turnaround. So the patient was delighted. So when we hand the mirror to patients after doing this sort of treatment, aesthetic work, you could see in his eyes he's very happy to finally get that smile that he's been sort of working towards with his orthodontic treatment, and he was super happy to see his new smile, a nice sort of natural result, nice colour, nice shape as well. There's no recovery process, so straight after the bridge has been fitted, he can go about his business, eating, smiling, using his new teeth as normal. So if you're looking to have a similar sort of treatment, come and speak to us first, because there's different options. Not everyone would go for this option. For his, we did a bridge off the front 2 teeth. Sometimes we use the canines, sometimes we do implants. Some patients that can't have those kind of treatments, we do dentures. So it's worth discussing all this stuff before jumping in and having some random treatment done, to see what all your options are and see what is best suited for you.